Hey folks, it's Dr. Gerstmar from Aspire Natural Health here with another vlog. Interesting question brought up by a patient, what to do about insomnia. Now here's the deal, this is a big topic. There is no one exact answer and there are a lot of possible treatments. I started copying down just a handful of stuff that we can do and found my list kept getting longer and longer, and I don't want to make this vlog an hour long, so I'm only going to cover a handful of things. Let's back up and talk about fundamentals. So when someone can't sleep, someone is not sleeping, now look, we can break it down into having trouble falling asleep or having trouble waking up and getting back to sleep. In this instance, we're mostly talking about trouble falling asleep, though we'll hit on trouble staying asleep a little bit. The question we really have is ultimately, why doesn't your body want to sleep? Because look, it's not a deficiency of sleeping pills that's keeping you awake, right? And then one of the factors, of course, is, are you overstimulating yourself? So some people break down caffeine, for example, very slowly. And one of the reasons people can have trouble sleeping is often because they're drinking either too much caffeine in the form of coffee, or energy drinks are a really big culprit that we find occasionally, rarely, things like tea or other caffeine sources can bother people as well. So there's a spectrum of people, how they break down caffeine, that ranges from people that can literally be drinking coffee as they're, sliding their feet into bed, to people who have, a cup of tea in the morning and can't sleep at night. So we often challenge our patients, look, if we have any suspicion that caffeine might be causing an issue for you, let's go 7 days, 14 days, maybe 30 days without caffeine and see what happens to the quality of our sleep. What we find for a lot of people who find that they are drinking caffeine all through the morning and into the afternoon, they often find the quality of their sleep improves. Now, they may not have full-blown insomnia, but they often find some benefit. So, look, the question is, why can't somebody sleep? The answer is there might be too much stimulation. So we talked about chemical stimulation from things like caffeine or other stimulants. Look, hopefully no one out there having issues with meth. Also, joking aside, things like ADD medication, Ritalin, Adderall, some of these things straight up are stimulants. One of the common side effects is trouble sleeping. So if perchance you're taking any of these medications, they could really be affecting your ability to sleep as well. So why are people having trouble sleeping? All right, so beyond that, we're not going to talk so much about some of the other medical reasons, right? If you have too much thyroid, if you have blood sugar imbalances, some of these biochemical or medical issues can all affect sleep. That's not our focus today. We're going to talk about some other things. So one of the most common issues, again, we talked about chemical stimulation. Now it's time to talk about kind of mental, other forms of stimulation for the body. So frankly, the first thing most of us desk workers like myself and a lot of quote-unquote professionals is that we use our brains a lot during the day. So by the time the day rolls around, we're feeling tired and fatigued, but it's more of a mental fatigue and often not really a physical fatigue. So one of the issues that we can have is we're trying to wind down and go to bed is that phenomenon of having a tired brain inside of a not tired body, right? Because from our body's perspective, what did we do all day? Well, we sat at a desk, we pushed some papers and keyboard, a keyboard around, and we really didn't accomplish anything to, burn off energy and wear ourselves out. So one of the things that can be incredibly helpful for a lot of us is simply exercise. Right? Get your body moving. Now, exercise done too late in the day, and again, that's going to kind of depend on the person, but broadly speaking, exercise that's done within an hour or two, or possibly more of bedtime, often doesn't help with sleep, but does the opposite. Again, it's a stimulation, right? The body goes, wow, we just did something major. There's an issue, right? All the heart's pumping, all the hormones get going, and the body is not ready then to turn around, shut down, and go into the rest and repair mode. So exercise can be incredibly helpful for most people. Doing it either in the morning, around lunchtime, or sometime earlier before dinner is often much more helpful. So if you find you're one of those people that commonly is tired in brain but not tired in body, one of the solutions is simply to get more tired in body, right? If you've had a hard day of work, you often have zero trouble getting to sleep at night. You fall into bed and you're ready to go, all right? The other type of stimulation can come from just simply too much light. So our bodies run on a light-dark cycle. Now, the way we evolved was simply to be up and active when the sun was shining, and for the most part to wind down and go to sleep when it was dark out. Wasn't really that big of a problem when the only type of lights we had around were either a fire. A little later on, we developed, candles and lamps and that kind of stuff. And I don't know about you, but I've had power outages at my house. It's very dark and you're sitting there with a few candles or a couple of lamps, and you realize just how dark the world was before the invention of electric lights. Now, electric lights are awesome. You can see them in the background here. I really appreciate them, use them every day, but there is a consequence, right? And the consequence is that our brain does not know the difference between a light bulb and the sun, essentially. Right? And when the lights are on, the signal comes to our brain that it is daytime and it's time to be up and active. When the lights turn off, it gets dark. It's the message that it's time to go to sleep. So look, light at night especially affect all of us. Some of us, though, are much more sensitive to this fact than others. Some people, really not a big deal. Other people find that it's a huge deal. And it's even worse. There's a very specific type of light called blue light, or the bluish light. So a candle, for example, or a fire in a fireplace has a very red quality to it. In contrast, blue light, especially the light that comes from screens, so that's your computer, right, that you're watching this on, that's things like cell phones and tablets, televisions, electronic light in this way is very skewed towards blue light. Now, normally that's true. That blue light is maximally disruptive, or the thing that most cues your brain that it's daytime. So, lights in general, not so great for promoting sleep, and blue light in particular, like that comes from cell phones, the biggest culprit, right? So those of us, sitting in bed looking at our cell phones can be massively disruptive to sleep. Now, it would be great to say, look, the answer is, turn off your lights. Right? There was a study that was done on both people who were considered, early risers and your night owls. And what they did was basically they took them out to the woods and took them camping with no artificial light exposure at night. And they found pretty quickly that no matter what they were, they settled into to the pretty typical pattern of go to bed shortly after it gets dark, wake up shortly after it gets light. So without electric light, or even, candles and lanterns and all of these things, and especially without our electronic devices, most of us would find that we sleep better. Now, a lot of us aren't willing to give up our TVs, computers, and phones and tablets and everything, so what can you do? A couple of quick options. Goofy as all heck, but you can get the orange glasses. Right, there's a pair that's tested the best. It's on Amazon. We can provide a link to it here. Costs about $8. Big set of goofy orange glasses. You're not going to win any awards for most sexy man or woman alive using these things, but they can be profoundly beneficial, especially if someone's really sensitive. So that would be, at least an hour before you choose to go to bed, you slap those puppies on, and if you're going to continue to use your computer or TV or those electronics, or keep the lights on full blast, the orange glasses can really help. Again, some people find they're not so sensitive, it's not quite as much of a deal, but for a lot of people, that exposure to blue light is a big stimulation. So look, we've talked about the physical stimulation that can come from things like caffeine. We've talked about stimulation that can come from exercising too late. We can talk about, if you will, understimulation of just not moving our body, not kind of tiring ourselves out. And then we've talked about the stimulation of too much light at night. The one last stimulation here is just too much excitement at night. It sounds silly, right? But again, if you're watching an action movie with lots of fast cuts and explosions and lots of crazy stuff going on, or disturbing news shows or horror movies, or, reading things like that, right? Anything that gets the body up and active, right? Again, our body can't really tell the difference between imaginary things that we're taking in, like television or movies or games or books, and what happens in real life. So just like, your body would not want to sleep if there were a serial killer chasing you, if you're watching a movie or reading a book about it and you're getting into it, your body thinks this is an issue and it's not going to want to go to sleep after that. So we really recommend, especially in that hour before bed, that people tone it down. They're inputting things that are more light and pleasurable and enjoyable, so they're not ending their evening by watching the 11 o'clock news about all the terrible things that happened that day or some crazy fast-paced thing. So the ultimate question we have is, why are you not sleeping? One answer to that is because you're overstimulated. Just like our kids can get overstimulated, we can do it to ourselves. So first step is to remove some of the stimulation. All right, folks, so we will cut it off there, the first part. So if you are suffering from insomnia, the first thing that we would like you to do is go ahead and check your life for those sources of stimulation and see about either reducing them or cutting them down. In part 2, we will talk about some more pieces that you can use to handle insomnia naturally. All right, folks, you can check us out at www.aspirenaturalhealth.com, facebook.com/aspirenaturalhealth. We also have these videos here on YouTube. Just go to YouTube and Google us, Aspire Natural Health. At Aspire Natural Health, we focus on treating people with gut problems, autoimmune diseases, and other hard-to-treat cases. We never give up on patients, and we are always striving to learn more so we can do better work by our patients. Please feel welcome to contact us. Until we talk again and part 2 comes out, take care.